Yes, I'm a licensed psychologist and I provide individual and couples counseling with adults 16 and up. And I also provide training and do workshops related around general mental health issues, but then specifically around cultural diversity and LGBT issues, relationships, and trauma. I think it's important to, and appreciate you inviting me here into this space specific about motherhood, perinatal, and birth coaching, because that is so well tied to the services that counseling can provide for women and their families. Being a the potential of being a mom, the idea of wanting to be a mom, the journey towards motherhood is very exciting. It is very confusing. It is both mentally and physically challenging and wonderful all at the same time. And appreciate being here because, as well as all the physical things that are happening, that women, they can benefit from a space to address the mental and the psychological things that are happening with them as well.
That is why I'm so excited that you agreed. I feel like that portion of it is hugely overlooked. Like, preparing for parenthood is mind, body, and spirit, and that it's all comes together, and not enough attention, I feel, is paid to getting prepared mentally. Being having to share your body, having to share your time, your energy, your efforts. And could you speak a bit about going on that journey, getting prepared? Like, what are some things you could do to do that?
Yeah, and like what you're saying, this journey that we go through, I think some of the challenges to women being able to get that help and support is because there's this idea of, pregnancy is the most natural thing that the female body can do. And part of that may be true, but that doesn't mean it's a straightforward process and journey. And there's so many things that impact what that birthing experience is going to look like and what that postnatal experience is going to look like. And that we can have these ideas because this is what I'm supposed to do, or my body is going to do the things that it needs to do. I know when I was pregnant, I heard comments like, women have babies every day. So like, what you're going through is not that big of a deal. Women have babies every day. That's true. Women do have babies every day. But when we're saying those sorts of things, or we're holding those beliefs or internalizing those things, it can stop us from getting the help that we need. Because women do have babies every day, and they can also feel anxious about having that baby. And they can have these worries about having this baby. And they can be having a baby in a system that could impact their health or their baby's health. So that we don't want to feed into those ideas of this is what your body's supposed to do, so you shouldn't feel these things. However you're feeling, that's how we feel. And being able to come into therapy, the therapy can be so helpful at those early stages of even contemplating beginning a family or thinking about having a child. That's not talked about a lot, especially within the Black community, is fertility issues. Again, this is natural, or these things are supposed to happen. But for a lot of women and a lot of Black women, it is not something that just happens. And being able to have a place to talk about fertility, infertility, pregnancy loss is an important place in those beginning phases of what therapy can look like in supporting women through their birth journey. And then the actual experience of being pregnant. So then lots of different anxieties can come up there. A part of that has nothing really to do with the woman herself. Your body is just changing and your hormones are all over the place during that time. So being able to have a normalizing experience of what you're experiencing makes sense developmentally for what's going on with you. However, if there is more extreme anxiety or more prominent depression, being able to treat those things too. And then therapy can be, sorry.
No, go ahead. I agree in that in terms of how you feel is how you feel. Yes, women go through this, but in that same vein, everybody doesn't know what's normal and what's not normal to experience. And that's just physically. So mentally, there's no normal or non-normal, right? It's just how you experience it. Is that what you're saying?
So the range of normality is so wide that there's so many things that can fit within that. And then there's some things that are going to happen outside that we would want to make sure that we're getting that attention and that focused care on. Like if our functioning is impaired or declining, if we're having thoughts about suicide or hurting others, then certainly we want to get help and support around there. But we don't have to be at those extremes to also come into therapy and get help around perinatal anxiety or postnatal anxiety, just questions about what does this mean to me? And as my body is transitioning, as my life is transitioning, what do I want that transition to look like? And ideally, we do want women to have healthy birthing experiences, for them to be healthy, for their baby to be healthy. But unfortunately, we know there's a reality that some women experience birth trauma, that plan A that you had for delivering your baby might not have worked out the way that you thought it was, and plan B didn't work either, and you might have had to resort to plan C. So that birth trauma, that's not what I expected my pregnancy or my birth to look like, or that my life could have been in jeopardy or my child's life could have been in jeopardy. It's a trauma. There was a potential threat to life, threat to self, threat to someone that we care about. How we prepared, we did not have those resources or tools that we needed at that moment. So coming to therapy can be a place to process through these birth traumas as well.
Thank you. Thank you for that. I always like to tell parents, a good outcome is just a healthy mom and a healthy baby. How you get to that point, or a natural delivery. That was a big thing. That's a big thing that I hear. I want to have a natural delivery. And I'm like, a natural delivery is a human baby coming out from this human mama. That's the natural. Anything along that spectrum, so long as you come out with those outcomes, it's natural. Yeah. So that if we have a vaginal birth, if we have a C-section, the goal is for you to be healthy, for your baby to be healthy. And it might not be how we thought it was going to look, but it does not mean that we still can't have a safe experience, and that we don't have to be psychologically wounded from those experiences. And if there is a psychological wound, that there is help and support that we can get for that. Definitely. I would also like to talk about when you're in that moment, when you're in those moments, how do you, I like to tell people, it's fine for you to speak up, but what do you say? When do you speak up? How do you do that? If it's not going the way you want it to go in that moment. Yeah,
being able to advocate for yourself, being able to recognize that you have a concern and that whatever your concerns are, they are valid and legit. That's a great way that counseling can be helpful. So being able to meet with a therapist and talking about, this is what my needs are, this is what my concerns are, and then working with your therapist about then how do you build your assertiveness so that you can express those things, or how do you best utilize your support system so then they can express those things for you. But we want in those moments, a woman's pregnancy and that birth is really one of the most vulnerable times of our lives, because there's so many things that are going on that are outside of our control, and there's just that instinct and that survival instinct to deliver this safe baby. So there's such great vulnerability in that moment that we don't want to minimize that you to be attuned to what's going on with you and being able to express whatever it is that you need to express. So ahead of time, using therapy as a way to figure out what are the things that are important to me and what do I want this to look like, and then how can I express that to my physician, my doula, my midwife, how can I have my birthing coach support me in these things? But I think specifically about Black women, being aware of the mortality rate, the maternal mortality rate for Black women. That when Black women are pregnant and then go into their childbirth, it's really one of the most dangerous times of their lives. That as Black women, we are 3 to 5 times more likely to die during childbirth or after childbirth than are white women. That's according to the CDC. And the older we are, the greater that risk becomes. And then also with newborn babies that have a white pediatrician, newborn Black babies that have a white pediatrician are 3 times more likely to die than our newborn Black babies who have a Black pediatrician. So there's nothing different about the babies themselves, it's the care that they're receiving. And there's still that we know these biases and disparities in healthcare. So for a Black woman going into her pregnancy and looking for healthcare providers, it's going to be important that she has someone who's culturally competent and understand these things, and it's going to take her concerns and her issues seriously. So using therapy as a way to talk about, okay, so when you meet with this physician, here are some things to be focused on and wanting to talk about, and making sure that you feel validated, you feel safe, and you feel heard in that relationship, utilizing those skills. And then secondly, we use therapy as a way to build our support system, that if for some reason you are not able to express those things, because all this stuff is happening in my body, I cannot also be thinking about, here's a question to ask, then what does your support system looks like in being able to advocate for you? That we can use therapy for that self-advocacy and making sure that we're working with our support team to advocate for us if we're not able to.
Oh, that's good. Now, speaking about the culturally competent, what are some pieces that you feel is missing with the training, the ongoing training of the people in healthcare for them, in order for them to be culturally competent?
Well, I think there's that, just the cultural competency training. What does that look like in the medical field? And if that's something that's ongoing for that individual woman, then we want her to be able to ask her physician, what are your experiences like working with Black women? And if there's miscommunication, if there's a cultural issue, then if there's a rupture in our relationship, how will you address that? And how can we work through that? Because again, my needs are going to be important. I need to feel validated. I need to be supported. If there is an emergency situation, what are the protocols and how is that going to be handled? And for a culturally competent physician, they just answer those questions. Okay. They would understand why a Black woman or a woman of color is asking these questions, because they know the history of medical treatment towards Black women. So they'd answer those questions so we could feel more confident in a physician who is able to articulate their value, their appreciation, and recognition of the needs of Black women.
Thank you. That was very specific. I thought it was going to be just like this flowery, like around the, kind of go around the bend to get it. No,
my life, and this is my baby's life. We don't have time to go around. If there's a crisis, can I trust you in this moment? And know that you're not holding these myths that Black people's pain tolerance is higher, and now I'm not getting the medication that I need. If you hold these biases that Black people might be seeking pain medication, therefore you're not going to provide me with the proper dosage of the medications that I need. No, this is my life. So when I say or I'm speaking up about something, I need to know that that's going to be taken seriously. So no, we do not have time to be going around the bush.
Get right to it. I liked it.
Right to it.
So I want to speak more to the getting prepared. I know that I feel like I was wholly unprepared. Our experiences are a bit different, but my coming into motherhood, I didn't even think about the part of becoming mentally prepared. And I want to say mentally tough, but that's not what I mean. I mean in terms of knowing how to handle certain situations. How do I handle my trigger? How do I handle triggers? And how do I deal with this baby or these other life stressors in the face of those things. So how would you tell somebody how would you help people get prepared in those moments?
Yeah. Yeah. So that preparation ahead of time and being proactive is important. And I think even asking ourselves it seems basic, but they're actually not really basic questions. What type of parent do I want to be? Who do I want to be as a mother? Who do I want to be as a father? What are the things and the values that are important to me? I think it's a good starting point in that preparation. So, like, what are the adjectives I would use to describe myself? Maybe supportive, caring, nurturing, open, growing. What is it that's going to describe me? And then trying to set up, the next question is, and what do I need to do to go about living that life, or really developing that person for myself and then for my family. Therapy is a great way to be asking these questions and processing through that. But it is something that's proactive and that we need to consider and be intentional with. That we, without being intentional, what we typically do is we act in a way in what's familiar to us, or what we know, what's been modeled to us. So we do things that our parents did, or what we saw, or what we experienced. We just replicate those things. And if we are not intentional in changing things, if we don't want to replicate those things, then we can find ourselves falling back into those patterns. Because sometimes we'll try to focus on, I don't want to be like my parent was, or this is not how I want my child to be. And we're so focused on not being that person that we don't actually develop who we are. So as long as I'm not like them, I'm okay. But I'm not actually developing myself. I'm not developing who I am as a mother, what's important to me, what are my values. And then when we face those moments of stress or pressure, we fall back to what's familiar to us. So we find, I said something that I thought I would never say to my child. We end up replicating those things. So we have to be intentional and proactive in making those changes so that we're not, especially when it comes to an intergenerational trauma, we're not passing those traumas down to our own children. So making intentional changes. So I think.
Join us as we continue our conversation on maternal mental health, making our transition into motherhood and parenting. Thank you for watching. Have a great day.